this is starting to happen in Canada, that they're legislating certain herbs. Like cat's claw, I think, is on the list of things that they're going to ban. DHEA is legal. There's a whole bunch on the list, and it's starting to become a real problem for us that we can't get access to these things. And from what I understand, it's actually started already, especially in Germany and Switzerland. And I was wondering if any of the panelists could, or other people could comment on this at all. Don't know anything. Will be legislated, sort of regulated via the pharmaceutical industry, so that you need to get a prescription from your doctor in order to get vitamins. And you can only then get vitamins at very small doses.
Some people, I think, some of the chairs and the presenters have showed that they've got good access to this information, but and somebody, I think, mentioned a source that they use, but getting access to this information, I think it's quite difficult, and maybe you could say a little bit more about possible sources or people here could say, because one of the things we're saying is, I've heard about this, I've heard about, but maybe there are some good places where we can get information about alternatives.
I think what was mentioned Bastille.
A lot of the information is from developed countries. Maybe there's not a lot that can be done about it, but it is an issue, I think, when people are making reporting on alternative medicine. They should also not only think about how it's going to be applied in the developed countries, but also how it will be applied in developing countries where access to doctors, access to CD4 counts, viral it's a problem. So I think, because often a lot of the information
con antioxidantes. Esta combinación que han cogido con estos grupos de gente ¿cómo se dice? El CD4, el CD4 sí, ha quedado normalmente, pero el virus sigue reproduciendo. No había diferencia. Eso mezcla no ha bajado y no estaba muy claro lo que pasó, pero que alimentaron de peso, suben de peso, tenían más fuerza para trabajar y más ganas de seguir en su vida. Eso era la cosa que estaban mirando pero es también una combinación que tienen que mirar, que no es solamente el uña de gato, pero es una combinación de el uña de gato con antioxidantes, y era una píldora de de una compañía en América.
Muy claro, muy completo y muy crítico. Una parte dice y todo el mundo empezó a aplaudir. Sí, bueno, no solamente, sobre todo no solo problemas a nivel de una risa.
¿Te estás grabando? Aprovísame.
Lo que estén hablando por atrás. Mi posición era
Dat geloof ik best, ja.
Ze heeft 2 dagen bij mij op het kantoor gezeten en uiteindelijk heeft hij dus iets van 10 dagen.
Ja.
We present the information about activities in the organization, and the first person is Mr. Javier Hourcade from Buenos Aires, Secretariat of GMP class, based in, and after all speeches. Okay, thank you very much. So.
The idea is to report for you part of our experience in the great involvement of people living with HIV and AIDS at the non-governmental organization level, at a very, very local level. It's not usual to be in this kind of...
I'm going to present to you a project we had last year, integrating HIV/AIDS into family planning services of VLFP-assisted family planning clinics. Enhancement of societal response to the AIDS epidemic has
more self-support groups.
El póster tiene como título El rol de la autoayuda en los grupos de ayuda mutua.
My work title is The Role of the Self-Support in the Groups, the Self-Support of Self-Support.
Dentro de los objetivos, los más importantes, entre los más importantes personas que vivimos con VIH-Sida, que asistimos a los grupos a fin de reducir el impacto psicosocial de la infección.
Objectives: to provide emotional support through the self-support to the people with HIV and AIDS who assist to the groups with the aim to reduce the psychosocial impact of the infection.
El otro objetivo, devolver tranquilidad, apoyar su autoestima, compartir un problema y necesidad en común.
Reduce the stress, support the self-esteem, share problems, and one common need.
Así también, brindar conocimientos para el empoderamiento de sus vidas, promover ayuda y apoyo, esfuerzos y habilidades.
Offer knowledge for the empowerment of his life and promote help and support, effort and skills.
Las personas que viven con VIH, que asisten a los grupos de ayuda mutua, logran, gracias a la autoayuda, aceptar, entender y comprender más rápido su diagnóstico.
The people with HIV and AIDS who actually participate in the self-support group achieve with the self-support the way to the acceptance, understand and comprehend more quickly his own diagnosis.
Generalmente es integrado por personas con algo en común. En este caso, el trabajo está basado en quienes vivimos con VIH y es nuestra experiencia adquirida en el transcurso de nuestro diagnóstico lo que nos lleva a compartir, lo que nos lleva a trabajar la autoayuda, dirigir nuestras propias consejerías de pares de persona VIH positiva a persona VIH positiva.
Our group is integrated by people with HIV and AIDS. That is the common issue that meet together in this group, and actually we can be able to develop our own counseling process as a peer counselors.
Dentro de los espacios creados por los grupos de ayuda mutua se encuentran los hospitales, ONGs o cualquier área donde puedan agruparse las personas. Pueden expresar sus sentimientos, compartir e intercambiar experiencias, tratamientos alternativos, información y recibir a través de la consejería apoyo emocional, ser derivado a servicios de salud especializados e identificados con la problemática del VIH-Sida.
The people with HIV receive self-support in clinics, NGOs, and any kind of place where the people can meet. The people find space where they can be able to express his feelings, information, receive through the counseling, emotional support, and also find referral to high specialized health service.
Son los intercambios de estas experiencias positivas y negativas lo que en los últimos años han hecho que en Lima, capital del Perú, existan 14 grupos de ayuda mutua, lo que evidencia su importancia o la importancia del rol de la autoayuda.
We understand that actually we have 14 self-support groups in Lima, Peru. That means that it's very important for people in
AIDS. In the Netherlands, we have professional care for people with HIV and AIDS. The next phase has been to ensure a good quality of that care, as perceived by the receivers, people with HIV and AIDS.
Very difficult for us to cooperate with the hospitals because they said, yeah, what's a patient, what dental treatment, and not to see that there's also
international fora like this one. Unfortunately, this time I'm the only one who came from the...
Espera que a través del trabajo de la red de grupos de ayuda mutua, red de comunicación e información para GAMS del Perú, puedan tener trabajos en común. Ellos se relacionan, pues la pregunta era cómo se relacionan, a través de un boletín informativo que los mantiene al tanto de sus actividades.
We can say that we have common needs or common concerns in regions or sub-regions within the Peru. We can say that the self-support group, each self-support group, it's come as a collective need of the people who decide to meet in this place. Actually, each group has communication through a newsletter edited by people living with HIV and AIDS, and also for the recently creation of the networks of self-support group, the network of camps in Peru.
Okay, there's another question from the end of the room. Welcome. No? Okay, thanks. So, please.
My name is Brett. I'm from Hong Kong. I don't know whether our situation is relevant to other countries, but we have a lot of, has anybody encountered that same problem, and has PHA groups been able to be a bridge or a linking method or linking vehicle to actually help monitoring or help development within the other NGO programs? That's one question. Another question with regards to the hospital format. Prior to going through the instruments of evaluation, because I find a lot of patients' expectations of hospital care significantly differ from what hospitals are able to give. And so there's a lot of stress involved in that through lack of understanding. Has any PHA associations actually done patient training on how to be patients when it comes to being involved in hospitals?
Your last question. We didn't do a training on PWAs how to act as a patient in the hospital, but what we did is we gave them, or we also cooperated with them, but if you are going to your specialist, what do you want to know from the specialist? Make a list of questions and that sort of things, but not exact about what do you have to do when you're not satisfied with the care you get. Then the HIV Association is going to the specialist or to the hospital to bring this, to talk about that complaint, but we didn't do a training. Maybe it's a good suggestion for the future.
In the Philippines, we have this Philippine NGO network of AIDS NGOs. And we also have this AIDS Society of the Philippines. It's a group of NGO and non-governmental organizations working on HIV/AIDS. And in my opinion, we should not be treating AIDS organizations as somehow responsible in bridging the gap between various NGOs. They should be treated as partners. We should not, in my opinion again, we should not be relying on AIDS organizations of people living with HIV as it's their responsibility to bridge the differences among various NGOs, whether in my country or anywhere else. They are partners.
I wish to add that it's the same feeling like the patient who go out of the counseling service. I think that when I am very concerned when an NGO belongs too many times from a network, and I'm very concerned when a client belongs too many times from a service. In some way, I try to think that it's positive that the client, and it's positive that the NGOs, some way decide to be independent.
Excuse me. I think I need to follow up on this question about NGOs working independently and sort of like not coming together. Because in some countries, I don't know if his situation is the same, that kind of a situation causes problems. Because you find that there's a lot of duplication of efforts within the same country, and you know, a lot of times the resources are very limited. So we sort of like you are competing on the same aspect, and the need for networking and close collaboration is very essential. So, you know, the Philippine experience is almost the same as what we have in Southern Africa. We eventually, you know, formed a network for the region, and then it actually promotes networking at national levels as well. And this actually helps both the donors and governments to understand the role of NGOs, especially where aid is concerned, and then we complement each other instead of competing.
Well, I think I would say that the PWA NGOs not only not only act as a bridge between the NGOs, but also as a monitor, supervisor, even criticize the policies, services provided by the NGOs.
That's why you have to be independent as an organization for PWAs. That's our choice in the Netherlands, to be independent. You can work together, you can cooperate together, but you have to be independent to criticize what's going on.
Yeah, I mean, I can understand the argument that, you know, it's good to be part of a network because we don't duplicate. But the other thing that worries me is if your small NGO that has limited resources and limited people spends too much time networking, becoming part of this, going to that meeting, how much work gets done where you are? You know, my worry is that as an emerging organization, if you are involved in your regional network, your national network, your continental network and your international network, you already have to go to 4 different meetings, however often those are. Maybe what would be good, and this is just my personal feelings, is that for a network to be strong, it has to have strong components. And I think that sometimes we're trying to do it the other way around, that we're trying to create the network before we've got the capacity in our own regions. So we need to find a balance between our own capacity as an organization and our ability to effectively contribute to the network. And I think, I mean, we could discuss this for days, but I think there is a balance, and there should be a balance that we just need to find for ourselves and our own organizations what that balance is.
Okay, thank you for your comment. And yes, please.
This is for Ms. Soledad. You said that besides scheduling, there's no difficulty in working with P+. Now my question is, what do you feel that needs to be improved in your collaborating with positive people? I guess this is one step further of the question of difficulties.
As I said earlier, P+, was also implementing then a project on capability building, and they have also projects with other NGOs and government organizations. That's why we found it very hard coming up with this schedule with them. And that's the only problem we had in our Yeah, would you please
scheduling is a problem that appears while you're working with a person who are involved in other organizations, but while working with...
No, that's with P+. Yes. Yeah, that's the organization of people living with HIV/AIDS.
Yes. My question is, do you find any difficulty working with a positive person? Besides scheduling, do you feel that there's anything that needs to be improved
person himself. Okay. When we conducted the first training program, the only problem we observed from the person himself, the PWA, is that he has this fear, still fear to somehow talk to a bigger group, because they are used in the Philippines. PLWAs are used to speaking before a group of students. But in our training program, their audience is a group of professionals, meaning to say doctors, nurses, and midwives. They are not used to be exposed to that kind of audience. But we tell them that you should not be treating them as a very special people. They are the same as the students, the same as nobody. We try to tell them that everybody is special, regardless of his or her profession. And we try to make them as comfortable as possible.
Okay, I think that's another question. Okay, 1 minute.
Living with the LGBT and the cultural context. We cannot talk about you must prioritize blah 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 blah, because each region has a special cultural context. And I think that in general terms, some experience in some countries in Latin America are very good when the policies of training integrate healthcare workers and people living with HIV. Brazil and other countries has a good experience when the issues for training in healthcare workers, not only biomedical aspect, to sensitize and human rights. And in general, in Latin America, the priority for people living with HIV in training, I think that is human rights.
Thank you for that comment. Javier, presentation mic.
Bueno, Pablito, espero que trabaje y que trabaje muy bien, pero que no trabaje tanto tampoco, que no se desgaste con su conferencia. Y lo otro, que nos ayude para la preconferencia comunitaria. Me parece que ahí han estado muy débiles y no se puede permitir que ULACETS vaya a ser lo mismo que hizo en Cartagena, Colombia. Yo pienso que en Chile ganamos puntos y Perú no puede permitir que se pierdan todos los puntos. Además, tengan en cuenta que es la primer preconferencia comunitaria de toda la región. Espero que cuando vaya esté muy casado, lo amen y esté muy saludable. Pues eso me parece el colmo, y eso es no quererse un carajo. Primero tiene que cuidarse y quererse mucho, si hablamos de empowerment.
Espero que estés bien, que te cuides, que te des tus tiempos y pues a ver si nos comunicamos. Mis datos, estoy mandando unos materiales, si les sirve sáquenle copia, están mis datos ahí.